Hi, my name is Maria Jones Muhammad, and the title of my presentation is Reduced Uterine Perfusion Pressure Prevents Seizure-Induced Reductions in Neurotransmitter Transporters in Pregnant Mice. I have nothing to disclose. Preeclampsia is a hypertensive disorder of pregnancy where the mother presents with new onset high blood pressure. If not treated in time, it can advance to eclampsia, where she presents with new onset seizures. Preeclampsia occurs due to impaired maternal spiral artery remodeling. In normal pregnancy, there's adequate remodeling allowing for adequate blood flow between the mother and the placenta. In preeclampsia, there's impaired remodeling resulting in impaired blood flow. This phenomenon is modeled using the reduced uterine perfusion pressure or RUP model. The RUP-RAT model was shown to have similar characteristics to that of clinical preeclampsia. In our current study, we have adapted the model to the mouse where we occlude the uterine arteries between the ovaries and the first pup. Previous work using the RUP-RAT model shows that when induced seizures using pentylene tetrazole, they have reduced latency to seizures. This suggests increased seizure sensitivity. The reason for this increased sensitivity is not known. Previous work shows that an imbalance in neurotransmitter activity increases the likelihood of a seizure, where there is an increase in excitatory and a reduction in inhibitory activity. We hypothesized that RUP mice have elevated excitatory and reduced inhibitory activity at baseline, and that seizures exacerbate this imbalance. To do this study, we performed the RUP procedure at gestational day 13.5, and we performed the seizure induction at gestational day 18.5. We inject mice with 40 milligrams per kilogram with pentylene tetrazole and video monitor them for 30 minutes. They're immediately sacrificed for later analysis. To summarize our pregnancy characteristics, we found that RUP induced a decreased number of live fetuses and increased fetal resorption. We found that seizures increased maternal hematocrit and that there was no effect of RUP or sham on maternal, pup, or placental weight. Using Western blot analysis, we found that there was a main effect of seizures to reduce neurotransmitter receptor expression and that there was no effect of RUP. Using fluorometric analysis, we found that there's a main effect of seizures to increase both GABA and glutamate concentration and no effect of RUP. Using Western blot analysis, we found that RUP impairs seizure-induced reductions in neurotransmitter transporters, EAT1, GAT1, and B-GLUT, where there's a significant reduction in sham but not RUP mice following seizures. We found that there is no effect of RUP to impair the expression of the scaffolding protein PST95, and there's a main effect of seizures to increase its expression. In conclusion, we found that at baseline, there's no evidence that RUP-induced dysregulation of GABA or glutamate signaling or changes in the scaffolding protein PST95 in the hippocampus. Our findings suggest that seizures induce reductions in vesicular and astrocytic neurotransmitter transporters, and that this is impaired following the RUP procedure. I would like to thank my mentor, Dr. Warrington, as well as the rest of her lab, my dissertation committee, and our funding sources. Thank you.